Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly briefing on the coronavirus pandemic. We see, and Dr. Bogan will be giving her report, we do see, continued increase in cases. We also see increases in vaccinations, which we're getting close to 778,000 of our fellow Allegheny County residents vaccinated. We're obviously halfway through the month of September with school in session for a couple of weeks now, Friday night football games and other activities and parades and different things going on. So Dr. Bogan will give her report, and we have a number of questions, I think, from the media that we'll be entertaining in short order. So Dr. Bogan, give your weekly report.
Thank you, County Executive. Good afternoon. Welcome to our COVID-19 weekly briefing. As usual, I will start with the data. In Allegheny County, we had around 300 plus cases a day this past week. Hospitalizations continue to increase slowly. And according to the Pennsylvania Early Warning Monitoring Dashboard, the PCR positivity rate for the county increased from 5.4% last week to 6.2% this week. The number of people who had COVID-19 related death also is increasing. In July, there were 11 reported deaths with a mean age of 80 years. In August, there were 54 deaths with a mean age of 72 years and a range from 41 to 99 years. Among those who died in August, 5 were age 40 to 49, 7 were 50 to 59, 9 were 60 to 69, and 33 were 70 or older. So far in September, we are aware of at least 21 COVID-related deaths. Yesterday, the Secretary of Health talked about breakthrough cases and released statewide data. So we're all on the same page. A breakthrough case is defined as a case of COVID-19 in a person who is fully vaccinated, that is 2 weeks past their full vaccination dose. The statewide data on breakthrough cases supports what we've been saying for months. The vaccines work. People who are vaccinated are far less likely to develop symptoms of COVID-19 illness, but if they do, they are much less likely to become seriously ill, be hospitalized, or die. But we also know that breakthrough cases of COVID-19 do happen, as they do with other vaccines. The state data, which reported on breakthrough cases since January 2021, showed that 97% of COVID-related deaths, 95% of COVID-related hospitalizations, and 94% of overall cases over the past 8.5 months were in people who were unvaccinated or not fully vaccinated. Now I want to focus on recent and local breakthrough case data. According to an analysis of the best data we have for Allegheny County, breakthrough cases in August made up about 23% of all new COVID-related cases. That was up from 18% in July and 7% in June. Before June, breakthrough cases were rare. As for hospitalizations in Allegheny County, according to our analysis of available data, about 10% of hospitalizations for COVID-19 infection in August were among vaccinated. Deaths due to COVID-19 remain uncommon among the fully vaccinated. Breakthrough hospitalizations and deaths were among the very elderly, frail with underlying health conditions, and those with severe immune deficiencies. In other words, the vaccines continue to do their job, protect from serious illness, hospitalization, and death. And I again urge everyone who is eligible to please go get vaccinated. But vaccinated or not, we must remain vigilant. Recent increases in breakthrough cases demonstrate how easily and transmissible the Delta variant is. For example, one case reported that they thought they were exposed at a wedding where masks were optional for people who were vaccinated. An outbreak was traced to a small private party where everyone who attended was fully vaccinated. And breakthrough cases have also been traced to camping events, concerts, and both indoor and outdoor gatherings. So given the increasing number of breakthrough cases, I continue to strongly recommend everyone follow CDC guidance, wear your mask, especially indoors, but also outdoors when you can't physically distance, in educational settings, and most importantly, get vaccinated if you're eligible. Consider your surroundings, your individual and collective risks, and make decisions that are safe for you, your loved ones, and your community. As always, I thank you for your time. Please be safe and be kind.
We'll begin with questions. First question, numerous organizations, including KDKA, Pittsburgh Business Times, the Post-Gazette, and Tribune Review, asked about the Allegheny County Council rejecting a proposal to require masks at outdoor events of 250 people or more and certain indoor gatherings.
I am going to let the county executive answer this question.
First question, something the health department is considering. Were you for or against the proposed guidelines? And what do you see as the county health department's role in masking?
Well, the county health department is ultimately who decides on a lot of the things that you've seen over the last year and a half. They've been authorized by the State Department of Health as the local Allegheny County Department of Health to deal with some of the things like capacity limits you saw last year in restaurants and gyms and sporting events and things along those lines. Obviously, the legislation you were asking about did not have a lot of support. I think it got 2 out of 15 votes to positively support it. And the health department is always monitoring whether it's vaccines, whether it's masking, whether it's all the things that we've seen over the last year and a half, and then they'll continue to do that. What we are for is following the CDC guidelines, and that's what Dr. Bogan has been talking about consistently since the very beginning. You may remember about a month or so ago, we were very much endorsing the CDC guidelines when it came to schools and masking. And I was very proud of the fact, I think it was 31 of the 43 school districts in Allegheny County had put the mandate in place. That was actually more than half of the entire state was our county following CDC guidelines. Obviously, since that time, the governor and the Secretary of Health at the state level put out a mandate regarding schools, the 500 school districts in the Commonwealth of Pennsylvania. But, there's good guidance that the county health department is continuing to put out following CDC guidelines, whether it is the Alpha part of COVID or now the Delta part of COVID, and the things that we must do.
Numerous organizations, including WESA and the Post-Gazette, asked for a general reaction to the federal vaccine mandate, and more specifically asked 4 questions. Would you like to begin with the general reaction?
Well, yeah, let me start with the general reaction. I applaud President Biden and the Biden administration for the very strong stance that they have taken. We see too many places in this country, and including even in our county, we're pushing 75 to 80% of our adult population that's being vaccinated, but we've got to get everybody vaccinated. We've got to get those last 20%. So I think what the president is saying and what he's requiring is people being vaccinated. And I think you're going to see more and more folks who aren't vaccinated, quite frankly, are going to be isolated from society. You see a lot of theaters now that don't let people in unless they're vaccinated. Our cultural district, the Cultural Trust, has come out with all of their venues, the Playhouse and the O'Reilly and the Benedum and Heinz Hall. You're seeing concert venues where performers are requiring people to be vaccinated before they get in. We're seeing more and more employers who are requiring vaccines to be hired and existing employees as well. And I think that's going, and you're going to see with schools, once the children are approved, once the FDA approves the vaccines for the under 12 population, that you're going to have a vaccine requirement to get into school. So I think the folks that aren't vaccinated are really isolating themselves from the rest of society.
The county said that they would mandate vaccines for new hires only. Does Biden's latest order change that, and will the county mandate it for all employees?
We're certainly considering that. I think I'm hearing again from more and more of employers, private employers as well as nonprofits and other institutions around the region that are going that way. I've been very gratified to see that there are many institutions, many companies that are well over 90% of their employees have been vaccinated. So, it is becoming more and more common for folks to do that. In our county, I think our workforce is now close to 74% of our county employees now are fully vaccinated. Many are partially vaccinated, and that number keeps going up every day. So between the testing requirements, the masking requirements of our county employees, as well as the folks that have already decided to get vaccinated, we're certainly moving in that direction. But it is something that's under consideration, and we'll probably be making a determination in the next couple of weeks.
How will the mandate be enforced?
If there is a mandate, they'll be enforced. It'll be a requirement of employment. You'll have to show your vaccine card. And I think that's the case when you go to a show, when you go to a concert venue, certain institutions, restaurants more and more are requiring that. So I think these vaccine cards are something that people are going to be showing a lot of. But for employers, it's pretty easy because you've got to, you put that in your personnel file, your personnel records. And if you're in an employment that requires that, you either get the vaccine or you have to go find another place of employment.
Roughly how many employers in Allegheny County will be impacted by the president's new vaccination mandate?
I can't put a number on that. I know his mandate talks about employers that have more than 100 employees. That's certainly a significant number of folks. But again, I see even the smaller than 100 employees. I see many of these folks, many of these employers are requiring that. And I know there might be a little bit of short-term disruption where you might have an employee or two that will decide not to work there, but over the long term, you'll be in a safer workplace where you know all of the folks that you're working with are vaccinated. And that makes just everything safer for that 8-hour or 10-hour, however long you're working at your place of employment, to know that the folks that you're coming in contact with are vaccinated, so you're not going to be taking that illness back to your family or getting yourself sick.
The last question regarding mandates. Is there enough testing capacity in the county for employers and employees to comply with this order?
Yes, and one of the reasons that that's the case is because so many of our employees and personnel, quite frankly, have been vaccinated, and that number continues to go up every day. So we'll make sure that the testing and those things will be in place. I want to applaud our healthcare facilities, our health department, and all the other institutions that have really done a good job of providing tests for people. And the key, again, is not just the testing, but to get people vaccinated.
Numerous organizations, including WESA, Pittsburgh Business Times, and WPXI, asked about the possibility of local hospital systems being overwhelmed and having to turn patients away or reschedule elective surgeries. Is the health department monitoring the situation, and are there plans to work with the State Department of Health and hospitals to help?
So of course I follow, and we all follow what's happening in our healthcare facilities, but to be clear, the health department does not oversee healthcare facilities, but I pay attention to the data. And I also am extremely fortunate that I have the opportunity to speak with the region's chief medical officers on a regular basis, and they are very nicely keep me up to date. I know they individually and collectively look at bed availability and their staffing needs, and I'm confident if they need to, they will make adjustments to their work as needed. Again, the hospitals, they do not need my help with this. They have it well in hand.
The state dashboard shows that there are hardly any pediatric ICU beds available in Allegheny County. What is the status of emergency pediatric care?
Again, hospitals, including the Children's Hospital, plan for surges, and the Children's Hospital is a regional referral center for the entire region, and they have the capacity to expand ICU beds if needed. However, again, I am not the spokesman for the Children's Hospital, and I strongly encourage you to talk to them about their plans and their ability to expand capacity as needed.
This next question comes from the Post-Gazette. Will Allegheny County do like other cities have done and consider a proof of vaccination requirement at major sporting events, professional and collegiate, and concert venues?
At this point, we're going to maybe recommend that some of the institutions that you're talking about certainly take a look at what's going on. My understanding is in professional sports league, there's a number of NFL teams that are requiring that now. I think there's 4 or 5 of them that the last I checked. And you may see more of that with the NHL, the NBA, Major League Baseball, the NFL, collegiate sports. We've seen a number of venues, concert venues, theaters. I mentioned the cultural trusts that are requiring that. More and more restaurants are requiring that. So I think you could see more of a shift to that. We'll certainly take a look at it on a case-by-case basis at this point. These are private, entities. They've put out some pretty good guidelines. I know the Steelers certainly have, and the Penguins and the Pirates. So, and each high school and each school district has their own restrictions and regulations that they've tried to do at the Friday night football games, et cetera, different activities that they have. So we'll certainly be continuing to monitor that and work with them. But at this point, we're happy with where they're going.
The next question comes from WPXI. There are a lot of big events this weekend, the St. Patty's Parade, Steelers, Pitt. How concerned is the health department, and what kind of spike could we see from this? Also, is there any update on potentially limiting fans for high school football games?
So I feel like I get this question every time there's a big event. And as I've said, every time, we monitor through our case investigations what happens. I really encourage people to follow the guidance. If you're out in a crowded place and you have risk factors, you can wear a mask, whether you're outside or inside. Do what is right for you and your community. And we will monitor for spikes in data, but we haven't seen enormous spikes from the football games that have happened to date. Again, we have small outbreaks from events, concerts, and things like that, but we haven't to date seen large spikes. And the last part was about football games.
Are there any updates on potentially limiting fans for high school football games?
I have no updates on that at this time.
That was the final question. If there are any closing remarks.
Well, thank you, Dr. Bogan, and the great work that you and the health department continue to do. Let me also weigh in a little bit on our hospital systems. They've just been tremendous. We're so fortunate that, number one, we have a very robust hospital system here in Allegheny County, 4 great institutions that have really handled this as far as the scheduling and capacity, and what we've seen in other parts of the country and even other parts of our state. As systems get stretched, they've really had some very, very difficult challenges, very acute challenges. We've been fortunate throughout the entire pandemic over the last year and a half that our hospital folks at UPMC, AHN, Heritage Valley, and St. Clair have all really maintained a very responsible and very, schedule-oriented way in which they could schedule, the elective surgeries as well as deal with any COVID. And again, it's because so many folks in this county have become vaccinated, particularly our more vulnerable populations, and that's really the goal. And as Dr. Bogan says week after week, showing the data how effective vaccines are. And again, even if there's a breakthrough case and you've been vaccinated, very, very little risk of you becoming seriously ill or being hospitalized or having a fatality. So vaccines are the key. We know that. We know that's the key for everybody. So we want to continue to get people vaccinated, keep people safe. We've learned a lot about the COVID over the last year and a half, when to wear masks, where to be, how to keep yourself safe, all these type of things. We want to continue to put out that good guidance as things change throughout the pandemic, and we'll see you again next week. Thank you.
That concludes this week's COVID-19 weekly briefing. The next briefing will be Wednesday, September 22nd at 4 p.m.